So what is it that you do? Who are you?
So I'm Meggie.
Hi, Meggie.
I'm a physical therapist at Helix Physical Therapy, just down the road in Danville. And yeah, I am in this line of work to help people feel better so that they can work out to look good or work out to perform better or just live their life and be happy.
So what is Helix Performance?
Helix Performance is a physical therapy clinic located in Danville, and we just specialize in working with people all the way through their injuries or before injuries even happen. We have some patients who come in that just want to identify movement inefficiencies and deficiencies so that they can prevent injuries. We have people who have had surgery, and so we get them all the way back to where they want to be. We have people that have experienced chronic pain. So we have a wide variety of patients that we see, but what's cool is that we see them all the way through. And so we help them one-on-one with exercise, with lifestyle modification, activity modification, to get them all the way to what their goals are, and then even beyond, while we are kind of educating them and teaching them how to continue that.
Sounds like full service right there.
It's a full
service. Yeah. For long-term success.
For long-term success, that's the hope, that's the dream. Yep.
First and highest priority question on the list, how much you bench?
Not enough.
Not enough. There you go. That's what we find out here, like, is that people come in with these preconceived notions. I know when I first started working out that it was, there's a look good and feel good component, right? Mine was to look good, right? That's why I started picking up a weight in the first place. Little did I know at the time that, who didn't care how much I benched? The very people I was trying to go after. So in your line of work, it's more of feel good, I'm guessing?
More of feel good.
Okay. Awesome. And we were talking beforehand, you're working 1 day a week at this particular location, and that's going to be, you're going to graduate out of that. Obviously, so a little bit of background about you. All I know right now is you're a mother of, your children are how old?
Almost 4 and 6.
Okay, 4 and 6.
Yeah.
So you're in a position where that is a full-time job.
Yes.
So why would you want to then put more on your plate with working as a physical therapist with what you're doing now? Like, where's that passion, that drive coming from?
Yeah. Well, I've been a physical therapist for almost 15 years now, and I found the passion a long time ago. I had to go through PT myself all through high school and college, so I was introduced to it early on, and then I realized, hey, this could be an actual job at some point, and really was into athletics and sports and the fitness community kind of all the way through, and got my sports residency program, and I stuck with PT all the way through. And so now I'm at a point where I have still been doing it, but it was just not at the amount that I had done before. So I'm at a point now where I'm getting back into treating more people and seeing more people, and I'll have more time and mental headspace to be able to do that.
Awesome. So you went through PT yourself?
Yes.
For what?
I had a couple sports injuries. I played soccer and basketball when I was in high school, and I tore both my ACLs and recovered from both of those in high school. And then in college, I broke my arm, unrelated injury, and then I did a pretty bad ankle sprain playing flag football. So I have been in and out of PT for many, many years. And I always was able to come back and had a really positive relationship with all of my PTs all the way through.
Youth is wasted on the young, man. You're bouncing back from all these injuries.
I tell you what, man.
I sleep wrong today. I'm done for like 3 days.
That's what all those years ago will do for you. But I was always able to come back, and I thought. I actually went to college for engineering, so it was completely unrelated. And
Still
then it
somewhat related, though.
Somewhat related,
right?
As what I found in hindsight. And then I got almost to the end of engineering, and I was like, like helping people in a different way. I like fitness, health, and wellness, and maybe I'll circle back. And I realized I could do PT, so I decided to go that route.
Okay, and then within that realm, when you're doing all these sports and bouncing back, was there something that struck you? Like, I know personally I've had coaches that really I connected with, and other coaching programs that maybe they didn't really work for me. Did you experience that, where it was just like there was different aspects of physical therapy? Because I mean, there's a preconceived notion of physical therapy, and it's not necessarily always a good one. You just kind of get left alone and put on a table, and you're just doing bands by yourself or some type of stim machine or something, and that's it. So was there anything that connected to you that was like an eye-opening experience within that, where it's like, wow, I really got back fast?
I think one of the things that was really helpful and eye-opening in that was it was a sports PT place even all those years ago when I went through it. And so I was able to go through the typical physical therapy and then followed up with strength and conditioning and speed and agility work embedded in that and transitioned to that at the same facility. So it really felt like the full start to finish of getting back to sport while I was still under their care. And and that is the type of treatment and training that I have always continued to be passionate about, is to be able to see people all the way to and through where they want to be, not just stopping when they can go up a flight of stairs again or walk again.
It's kind of like the what is it, the RDA for different vitamins, right? It's like, it's recommended 100% of your RDA daily allowance for vitamin C. And it's like, well, that's not optimal. That's just so you don't get scurvy.
Right.
You know what I mean? Like that's not a good life right there.
That's right.
So that's for you, that's what you're looking at when it comes to movement, right? So it's like, okay, where your ideal is and what worked for you, do you think that's where the physical therapy industry is as of right now?
I think everybody has different experiences with physical therapy. Even us physical therapists have there's a variety, just like there's different types of studios, there are different types of massage places, there are different types of chiropractors, there are different types of practitioners. And some people might have the experience of being left alone on a table or only having their 6 weeks and then they're done and out the door they go and are expected to kind of fend for themselves.
What did you feel like that's the more of like, because I know that's, if you're going through the traditional like medical system, that's kind of where the push is. It's not necessarily like if we were looking at the umbrella of insurance. I'm not trying to get into the weeds here, but like I feel like that's more prevalent almost, that what most like general population is exposed to. They have to like go and look for a place like Helix.
I would agree with that. Yeah. The medical system right now, especially because it's insurance driven, it often has caps and limits on things without looking at the individual patient. And so there are already parameters set before the patient even walks in the door. And that's not fair to the patient, nor is it the best line of care. And so that's a challenge for physical therapy right now. So there are more and more private practice physical therapy clinics that are popping up, like with people like me, where I have been in outpatient clinics before, but have chosen to do something different so that I could try to do better by the patients and the clients that I see.
Now, would you say the internet has helped or hindered your mission here? Is it?
Both,
Okay.
actually. I think there's a wealth of knowledge available on the internet.
It's a very PC way to say that.
As long as you know what you're looking for, because you
Yeah.
can find anything that you want to find in
Yeah.
whatever you're looking for. So you have to, I think, some people can go that route and just blindly follow somebody or something that they read, and that can be a detriment to them because if they're not asking the questions or don't have the proper guidance for exactly what they're going through, I do feel like that could be a challenge.
So if you were a general population person and you had some type of injury, what questions would you ask? Like, what would you qualify as an expert? Like, what is there to look for? If I'm like, okay, I got a little bit of a tweak and maybe I'm on social media, what should I be looking for in somebody's profile to be like, hey, maybe there's probability that this is a pretty good source?
Oh, I see. So you're asking if you had the injury and you were searching the internet, how would you be able to vet somebody that you are getting information from?
Like, I mean, it's not like, you have to take everything as gospel from them or anything like that. But at the same time, it's like, okay, if I want to be a patient that is like, okay, I'm educated or I'm trying to educate myself, what am I looking for?
Yeah. I think when it comes to actual injuries and trying to rehab and recover from injuries, physical therapist, that is what our profession is. So having that as a baseline credential is a good place to start. I think there's a lot of different types of people in the fitness industry that have maybe good intentions and are trying to help people, but they might not have the full experience or wealth of knowledge that we have, where we can kind of go through and identify the actual things that are going on with a patient.
Yeah. So just to clear definition, physiotherapist and physical therapist, same thing?
Yes.
Okay.
Different countries.
Yes.
Same profession.
Well, I had the conversation with Cez, the global head of programming here for BFT. She was very adamant about trainers not getting outside of our scope of practice, doing what we do and doing what we do well, but then referring out to a physiotherapist in that case. Do you feel like there's some people out there where nowadays everybody's trying to kind of co-opt your industry a little bit, where they're trying to take on more than what they're qualified for?
I think that's the case in a lot of our the healthcare industry right now. I think there are athletic trainers that are trying to do some things outside their scope. I think there's physical therapists doing things outside of their scope, massage therapists, chiropractors. Like there is overlap with all of what we do, and I think it works better if we can identify what our scope is and what our strengths and weaknesses are, and team up in a relationship with people that have expertise in the things that we have weaknesses in, but work together on that. Because there are definitely people that feel like they can be the one-stop shop for absolutely everything, and I don't think that's doing anybody a solid at that point in time.
Yeah, he's a jack of all trades, master of none.
Exactly,
yeah,
100%.
And that's, like you said, back to your original point, that's not fair to the patient themselves, right? And that's
because it should all come back to what is best for them.
Yeah. And it's client centered. And so when we're talking about that with, say, BFT and Helix, what is your vision for a proper partnership within that, as far as having a client, say, they come in, maybe they've never worked out before, they start a training program here, and it's a lot for their body, right? And then that, in addition to just life happens, at some point they get a little tweak. Without having to go into details on it, you know what I mean? But some type of little tweak there. Should they continue here at BFT? Should they take a second out and just completely rest? Or would you say that, like, maybe seeing you and seeing, like, okay, maybe there's some corrective exercise that could work in conjunction with the training program? Because that's the thing, is that the reason why I ask this question is I deal with doctors that are not necessarily physically cultured, I guess would be the word for it. And so they just say, stop immediately, no matter what you're doing. And obviously, there are instances where that's appropriate. But for the general, like, overall little aches and pains, is that something someone should be doing, or what should they do?
Good question. I think a lot of people assume that is what they should be doing. And in most situations, it's not what they should be doing. And I think movement can be medicine as long as it's the right type of movement. And so I think the person who is injured needs to have a little bit of understanding or guidance about what can they still do, and what can they do to help what is injured, but then what are the other types of things that they can still do to move their body and exercise and keep moving. So to answer your initial question, I still think they should be coming here, as long as they feel comfortable with it and the coaches feel comfortable with it. And that's where the relationship can come in handy, to know these types of modifications, these types of alternate movements. These are the things that we really shouldn't be doing, but these are all the things that the patient can still be doing and should still be doing to keep their body moving, their blood flowing, and their tissues healing. Yeah,
I mean, ultimately, when you say movement is medicine, I mean, like, your body's trying to heal itself, and you can't really do that, when it's just staying still. Can't steer a parked car. So that the idea would be that you'd be moving in some way that maybe you're addressing that particular issue. I know there's a couple members here, for instance, if you're looking at archetypes of typical injuries that we see, or different, like, overuse injuries, I guess you could say, repetitive stress. Take somebody from a desk position all day long, and then they know they need to work out, right? Summer's coming up, or summer's here already, they want to get a six-pack. And the idea is that, okay, yes, we're working on general physical fitness, but this position that we've now been in for however long probably does not lend itself to proper movement patterns. Right. So we have a couple, like, overall injuries. I know plantar fasciitis. Okay. I know frozen shoulder. There's a couple instances like that where what would you suggest for someone if they came to you with a typical injury like that? Obviously, everybody's different, but came to you, what would the process be like when they come to see you? They're like, listen, I just deadlifted 400 pounds at BFT. I'm loving the training program, but my shoulder, a little bit of frozen shoulder happening right now. What should I do to keep the momentum going? Yeah, so for both of those types of situations, when they would first come in, we would hear the whole history, find out what their background is and what their background is like, but also
what they're trying to do and what they're trying to get out of it. Because with some types of shoulder injuries, you can still lift from down here, but you just can't go up overhead. Yeah. Some types of foot and ankle injuries, like plantar fasciitis, you can still do a lot of things, but maybe certain types of the sprint drills might not feel fantastic for you right off the jump. And so it's getting a sense of what their history is, and then getting a full picture of those movement patterns. Because you're right, so many injuries come from, we call them the weekend warriors, where they're busy working and stuck in one position that our bodies are not meant to be in, the seated position all day, every single day, which is what our culture and society does now, unfortunately. And then they try to push their bodies in ways that their body is not prepared for.
I mean, you have to. I mean, you go all week, the only thing that's keeping you motivated is that you're going to demolish your friends and family in a recreational sport that means nothing.
Yes.
Like, you know what I mean? Like, you got to get motivated.
You have to be motivated. I totally agree.
Yeah, like golf, cricket, whatever it is, I need to win, you know? So that makes sense to me. But what you said just now, it really stands out. It's like not just where they're at or their history. And I think that's where most people focus, right?
Yes.
The whole industry focuses on that, where they're at and their history. Awesome.
Yep.
You said where they're trying to go.
Yes. And that's the biggest thing but you have to understand where you've been to know where you're going, but also to put it into words of, this is what I want, and these are my actual goals. And then, like, how can we then work together to create those goals? I mean, that's what we do. Yeah. Everybody has a goal or multiple goals that they're trying to do. And it's like, we want to get you there safely. We want to get you there effectively. And I think you are exactly right. People get very hung up on, oh, this hurts, so therefore I can't, blah, 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 blah. And we try to say, yes, I hear this hurts. This is why it hurts. So let's do this and move forward. And I think that's the difference.
And when you're talking about where they're trying to go in general, like, there's extrinsic and intrinsic motivation, 100%. Right? And extrinsic is, you know, that external factor of, doctor says I need to work out because my health is a concern moving forward. Even though they could see that doctor as an authority, it's still someone else telling them what to do, right, versus the intrinsic component. As far as success of your clientele, the most successful patients that you've had, is it a scenario where it's like they've had a wake-up call, or is it a scenario where it's like they want to get back to a particular activity, like, or even just playing with their kids? Like, what is your success stories? What is kind of like a through line for those people?
The long-term success, it has to be intrinsic motivation. So whatever journey people get to that point, it can be a wake-up call, it can be having children and having not had them before, becoming a grandparent. You know, there's different things that happen in people's lives, but it has to be, the internal motivation has to be there. And I think the long-term success, one of the biggest things that we try to do and pride ourselves on, is educating and empowering the patient to teach them healthy lifestyles. You know, it's a lifestyle change and a lifestyle management situation in your line of work as well as mine. You know, it's not just a one-off. You don't just see me for 6 weeks and then you never hear from me again. They don't just come in here for the 8-week challenge and then never hear from you guys again. It's
hopefully not.
Hopefully not, right? Yeah. But it's creating health and fitness and wellness and educating them, but empowering them, showing them all their successes, giving them short-term attainable goals, and then showing them how each of these short-term goals can really lead to this long-term, like, this crazy goal that they might have. It's not that crazy when you break it down into sizable chunks. Yeah. My grandma always used to say, you can eat an elephant one bite at a time, or something like that.
Yeah, that's what it's like. How do you eat an elephant one bite at a time?
Right, yep. Something like that. And so but it's so true, because it can be very daunting when you have this massive goal. Like, I've never run before, but I want to do a marathon. Like, whoa, I'm frozen because I don't even know where to start. Yeah. But if you start just literally chipping away at it, you will be able to you will move in the direction that you want to get. And the goals might change and the goals might shift, and that's okay. But it is now built into kind of your own DNA of, I want to be fit, I want to be active, for whatever the reason is. It could be health, it could be people, it could be physique, it could be any of those types of things, but it has to come from within for it to stick.
Now, over the years, right, would it be a situation where that you've seen, because what you're talking about is process-oriented versus outcome-oriented, right? And I think now, I sound so old, nowadays,
Back in my day.
yeah, back in my, because of the advent of social media, and it's so prevalent that everybody's this comparison game. I mean, what is it?
Yes.
They've done studies where it's the depression, especially for young women, has skyrocketed since social media access has increased. And so you're comparing yourself to everybody else's highlights, everybody else's outcomes. Have you found that it's a little bit harder to really get the point across, like this is a process, versus the people's patience for the process?
Yes. And I think part of it is the culture nowadays. It is such an instant gratification culture. People are looking for the quick fixes for everything, the fad diets, the quick, like, oh, if I just do this one thing, then everything will change. And we know, studies show that type of stuff isn't sustainable anyways. And so that can be hard. And I think that's where I go back to showing the short-term goals. And it's like, okay, this is what we're focusing on right now. When you can do this, then you get to go here, then you get to go here, because then it feels like they're getting those wins. They're seeing the results a little bit faster, even though it's not the marathon right away, but they're able to get those small chunks, and it keeps them motivated, and it keeps people bought into the process a little bit more.
Yeah, I mean, I like that mindset. I went to a lecture by a Navy SEAL by the name of Andy Stump, and he was talking about when he went through Bud's Week, and it's like the hell week that they go through, where you don't sleep for a week. You literally do not sleep for a week, and this is where everybody drops out. It's like, G.I. Jane, all those movies are about this, right? And what he did to get through it was he was like, okay, it's Tuesday. If I focus on the fact that I have to get to Sunday, I'm quitting. There's no way. That's way too far.
Yep.
He's like, I know that they have to feed me every 6 hours. Just get to my next meal. And that's all he did throughout the entirety of the week. I'm not saying it was easy, but he got through it in that way. You know, am I comparing BFT to Navy SEALs training? I don't know, maybe. But the whole point is that if you keep your world small, where you're trying to get to, you will get to. It's just that one step at a time mentality. But within that, though, there is that holistic approach that you're talking about. We're looking at it as a whole, because if they just focus on, that's the bad thing, right? When I used to personal train, it's like, people would come in, oh, I checked the box that I worked with a trainer, right? And then like the 23 other hours out of the day was kind of, I'm not saying going against our training, but the thing was like, did you do your homework? Did you do your diet, whatnot? And every time I got sick of hearing the phrase, but at least I'm honest. Because they would be like, no, I didn't, but at least I'm honest. I was like, that made nothing better. Like, I don't know why you would think that. So within that, the inflammatory aspect of how we live, does that directly affect you working with the patient, where if they're already got a high inflammatory levels, like if I'm talking to a health coach and they're telling me like, hey, it's allergy season right now, people are already going to be inflamed somewhat. Is that something that you need to take in consideration, and then you can communicate that to the client so that way they don't get kind of crushed, they know it's a process?
Yeah, I think that is part of the education piece, is reminding them that the body is a lot of systems trying to work together or sometimes fight against each other, and educating on that. Because I think it's also important, though, because that can't be then an out, like, oh, you're inflamed, so therefore, or it's
I have
like
the sniffles, so that's why I didn't do my homework. Yeah,
right. Yeah. And I think that is part of the whole thing. Like, to continue to live, we have to live through all of these things. Now, I can educate you and remind you, like, yeah, you should probably sleep more than 2 hours a night, or your cortisol levels are going to be da-da-da-da-da. Yeah. And, you can go down the rabbit hole of that and be like, oh, by the way, make sure we're doing more strength training, probably squeezing a little more protein. You try to feed them, again, in the small chunks of like, these are certain things that will only help you in this process. Now, if we stay at this inflamed level, everything is going to be harder. If you keep, I always say, like, every time I always have these patients that are like, let me show you the thing that hurts. And they like are looking for the pain and looking for the pain to show me. I'm like, I believe you. You don't have to show me. And I say, every time you are showing me the pain, it's like scratching off a scab, and it's going to bleed over and over and over. And then you have to wait for it to heal and scratch it off and wait for it to heal. And I said, let's be done with the scab. Like, just let it be, And
like, I feel great, but let me show you how.
Let me show you this one thing. Like, well, okay, cool, we're good.
Yeah.
Yeah. So I think it is holistic, and it has to be holistic. I think we'd be doing everybody a disservice if we if we only thought like, yes, PT is just for the musculoskeletal system, I'm only working on the muscles, and that is the only thing that we are doing, because a person is made up of more than that.
Well, the biggest eye-opening fact for me was that, okay, how do you recover from exercise? What system is responsible for that? And you're like, everybody, their first year kinesiology students were like, oh yeah, musculoskeletal system, got it. They're like, ooh, it's the immune system. You know what I mean? Like, you need to recover from that. And that's what we see here, is that what sets BFT apart, when you're talking about different studios you're looking at, is that the program itself, it's not who can win the heart rate board every day. It's not just as hard as you can every day. It's the component of, okay, we're gonna have high intensity days. Yes, that's a part of it. But we also have moderate intensity and low intensity. So that way you're part of a program where you can actually recover. I think.
And it's built into the program, which is fantastic.
It's like, it's one of those things where it's like, everybody's so focused on, in our case, in the gym, the weights, but I'm sure in your case, trying to rush to that finish line, that it's the recovery component that needs to be stressed. Is there anything that like you found that really works for recovery? Because you see all these charlatans out there. Is there anything that you know that are like, okay, when I tell someone to help heal their injury in general, what would you recommend? On the spot.
Yeah, I mean, that's a tough one, because it is different for every single person. And I think it does just go back to allowing the tissues to recover, but telling them, and then you have to know your patient, because some people are like, cool, I'd love to just lay on the couch. And other people are like, no, I got to keep moving no matter what, nonstop. And so you have to figure out how to approach every single person who is very different, has different goals, but also has different tissues that are injured in that moment, and be like, okay, well, you want to keep moving, great. We can't be giving you impact, but you can swim. So I need you to now go in the pool, and you give them exactly what it looks like, because the person who needs to keep moving needs that prescription and everything written out and very, very, very clear.
Now, do you have to write prescriptions for things that are outside of physical? Like if it's like when you're talking about sleep, you're talking about nutrition, like how far do you delve into this? Do you just give them general overall guidelines?
General overall guidelines, because it's outside of our scope. And so, we all have different types of extra learning or education or classes that we've taken to help round that out, but it's not like, we're not registered dietitians also. So it's like, I'm not gonna also give you a meal plan, but I can give you some like, hey, you should check out this, some of these good resources. I'll give people resources about, diet or sleep or certain things like that, and give my own personal recommendations, but they'll have to do a deep dive or talk to somebody more specifically.
Is coming from so you did outpatient in a sports rehab?
Yes, I've been sports my whole career.
So coming from that into the demographic that we have here in San Ramon, California, where have you seen like the differences, if there are any, from that sports background? Is there anything that's been like eye-opening to you about what's the demographic in this particular area and what they need?
So I've worked with I call it more athletic background. Okay. So I use the term athletic as anybody who is motivated and willing to work and has some sort of a fitness-based goal. And so that is what the people are here as well. Okay. And so that's what I love.
So it falls underneath the template of what some would call an athlete. Yeah.
It's a functional athlete. They're doing functional fitness. They have athletic endeavors. They have athletic goals, and it doesn't have to be specific, like how much can you bench, but they have the drive to keep their body moving. And that is, with that type of exercise and activity, there's different types of injuries you might see in soccer versus somebody who's just doing powerlifting, right? Like, just because they're such different sports, but they're two different types of sports, and they still are motivated to get back to those activities.
Is there a common or relatively common injuries? I know I was talking about the archetype of the injuries that we see here. Is there anything that you see like kind of, we're getting a lot of this type of injury coming through the door? Is there anything out there?
It just depends on the sport, because there are very specific, well, not very, but more common things depending on the athlete. Yeah. Like at Helix, we'll see a lot of baseball players, so we get a lot of shoulders and elbows. I've worked with a lot of soccer players. You see a lot of knees and ankles there. Basketball players, more ankles, some knees, a little bit of shoulder.
But yours is for general population as well. Mm-hmm. Yeah. So, and that's what I liked about your facility, is that it's a gym.
Yeah.
Like people think it's like typical, you think you're going into a doctor's office, right? So I think that I'm gonna
like a sterile room
sitting in a waiting room. There's magazines no one reads right next to me, like that kind of thing. And then your facility, it's a mini gym. And when you go into it with that mindset, it's like there is a participation component. You are participating in your own recovery. It's not passive. And how would you, with your experience, how would you rate the results that you've seen versus like passive modalities versus active modalities?
Passive does not work. You have to be an active participant in your own recovery, or else, nothing will be long lasting. It goes back to like the long-term success conversation we were having earlier. You have to be bought in, you have to believe in it, and you have to put in the work yourself. And so it is hard because it's not a quick fix. Often you will feel better when you leave a session, but that's where the work starts, not where the work ends. And then you don't get to, unfortunately, just sit around for the next week until we get to meet again. So it is a very active, and that is why I really enjoy and appreciate working with the athletic population, because they are motivated by something that usually has come with it, whether they're competitive, whether they have their own reasons, but a lot of it comes from the internal because they've built it into their lifestyle already, and it's part of their identity, and they want to be able to get back to it. And so they will put in the work, and they will see results because of the work that they're able to do.
And so along with that though, like, is the objective measure, I know it's different on the injury, is the objective measure a performance based, or is it literally just getting out of pain? Like, I feel like that's so vague. I had, the psychosomatic component of it, where it's just like mentally, if you've been struggling with an injury for years, then you're automatically guarded against doing certain movement patterns. You're expecting it to hurt. So that subjective component versus how you feel against the objective performance metric. Have you ever had a situation where it's just like, you're doing great, and they're like, no, I feel terrible, I'm not gonna stop. You're like, you're doing, just keep going. Like, have you ever had any instances like that?
100%. It happens all the time. And I think a lot of people forget about how important the mental and emotional components of injury are, not just the physical, because
it's like holistic, only with the entirety of emotional component as well.
Right. Because people will put up mental and emotional blocks and hurdles. Their identity has been stripped. They're used to working out 5 days a week, and now they can't at all. Or there's different things and different reasons, but it can affect people in a lot of different ways. And all of those systems have to be moving forward to make the entirety of you move forward. So yes, that type of thing happens a lot. There's revisiting of the progress that has been made to remind people. I find a lot of times people are with themselves 24 hours a day, 7 days a week, so they can't see the amount of improvement. But then when I'm able to see you, I'm like, wow, like do you remember what it was like last week? And they don't remember. And it's like, this is where you were, and now look at where you are, and now look at where you are. And to help them see those mini successes, which are really the big wins that can help to keep somebody motivated and moving along.
Yes,
and we do have to get creative with the mental hurdles sometimes.
You have to. Like, it's things like that's why we have the eVolt body composition scanner in the 8-week challenge.
Yes.
Because they don't, like, if I'm gaining or losing weight,
right?
you see yourself in the mirror every day. You're like, you get down on yourself, and it's like, okay, well, let's revisit this. And then you go to the body composition scanner. It's like, I had this the other day. I had a member here that literally like lost 5 pounds over the course of 4 months, right? And she was like, well, I guess. And I was like, wait, hold on. I was like, how are you feeling? She's like, I feel fantastic. Okay, let's take a look at the composition. Oh, wait a minute, you gained 12 pounds, so there's your weight gain, and then you lost 7 pounds of actual fat. So it like has to be kind of put, as soon as that clicked, she was like, oh yeah, oh okay, now it makes sense. But if you just like look in the mirror every day and you're just like overanalyzing yourself every day, you don't get to be able to see these changes.
You're right.
And then with the mental part, what I find funny is that when you're saying all these things about the mental is stopping people from like really pushing forward, I got 2 words that describe this perfectly. Box jump. I'll get somebody you're just staring in front of a box. You can step onto the box, but like just that, I've seen so much of this, like, where it's just like, just kind of, you want to be like, you can do it, believe in yourself. And it's one of those things where you see it in real time. And as soon as they actually let go and trust their own bodies and actually are able to do it, then it's like, I'll see that same person repping that box jump out the rest of the day. It's just that first time. And I think that is like you or at Helix are basically teaching people to trust their bodies again.
Yes.
Because that part of it is like, you know, I go to step and I've had knee issues. I go to step, also my knee gives out. It's like, how can I trust that knee again? You know what I mean? So the mental component of coming back from an injury has always been the hardest in sports. And if you think of it as life as a sport, I guess that would be like a constant 24/7 thing in the back of your mind, worrying if it's going to give out again.
Yeah.
And when you're trying to like run around with your kids like you are, you can't have that.
That's right.
Yeah. So when you're trying to get this emotional buy-in of someone, they really want to connect with their life, what about like with your kids, right? So the support component, the part where there's people outside of the gym that they're supporting them. Have you found that it's more successful when they have support, like a community of sorts, or is it, you know, I'm sure there's some people that are just like isolated and they're fine with it, but the majority of people, there needs to be some type of team or something, right?
Yes, yeah. And that, studies show that proves to be more successful, 100%. But I think that's the other part that's cool about when studios and facilities team up, like we become some of that community as well. Because even if the person is choosing to go on this journey on their own, in their own family or within their own relationships, at least they've got the coaches and the therapists and the this and the that are also kind of like help to motivate and help to build that. But yes, it's 100% if you can have the support of your partner or your friends or people joining the journey with you or supporting you and encouraging you to do it. Or I have a lot of patients where it's like, oh yeah, I was able to do my exercises and my kids were doing it with me. And I was like, that's fantastic, right? Because then all of a sudden it's not taking time away from your family or time away from this. It's like a shared experience that can help you. I mean,
that's exactly why we do like challenges here where you do it as a group. But you bringing that up is it does remind me, it's like, I've had multiple times where, you know, work with people over the years and you're like, well, I could give you like 45 minutes of corrective exercise to do every day, but you probably won't have that great a quality of life. So for you, is it been a challenge to find time for people to work on their own recovery? Because I mean, it's so busy out here. Everybody's in tech and finance and like, you know, they gotta go. Is there anything that you've seen where it's like some strategies work well, or any experience with that?
Yeah, and that's a lot of what we talk about at the first session. Right. You know, I get a feel for, or I ask directly, I said, okay, how much time can you give me per day or per week? And when is that gonna be? You know, not that I need to know exactly when it's scheduled in, but it's like, how can we build this in? And then there is some creativity when people are like, well, I don't have any extra time. It's like, okay, so how can I throw in a little bit of this? Like, okay, every time you're in and out of a chair, you gotta do this. Or every time you brush your teeth, you gotta do this. Then it's like, you have to put something with things that they're going to do and they have to do every single day, and you just have to get creative. But most people are able, especially if they have a history of working out and enjoy it, and I've been sidelined by it, will say they have somewhere between 15 and 30 minutes most days of the week that they can consistently do. And so then you have to just find the heavy hitting exercises that really do the things that are best for that person, so that we know that they can stay consistent and be able to do them.
Okay, and then over here at Helix, it sounds like you work with a lot of athletes. How long have you've been there? How long what's the history of Helix?
The history of
Helix.
I
like the name, it's a cool name, but like what's the history?
Helix has been around for almost 2 years now. Yeah, the owner has worked at a different outpatient facility and decided to start his own, and I just joined a couple months ago. I also had been working at different outpatient facilities, did some of my own stuff, and then decided it was time to kind of join forces. And it's cool because the owner and I have very similar mindsets and mentalities when it comes to treatment and running a business and that sort of thing. And so we're feeling our way with that and becoming a team. Yeah, it's pretty cool.
Yeah, that's great. And then so over there, right? So you alluded to it a little bit. If someone first comes into you, and obviously all injuries are different, right? All issues are different. On that first consultation, are you going over, okay, we need to do like 3 sets of 10 of this, or are you going over like exactly what you talked about, where it's like, okay, how can we be most successful in this? Like, how can we approach this as a lifelong pursuit?
It's more that we always make sure that there is some homework that they have of some sort by the time that they leave, so that there's it's very clear what is expected of them and what the plan is moving forward. But a lot of it is trying to figure out what is realistic in how we can best work together as a team. And I think that's the biggest thing, is like, we at Helix view like the partnership that we have with our patients as a team. And it's like, we are working together to solve this problem that you came in with us. So I'm not gonna just bark at you and tell you what you need to do in your life when you only see me for 1 hour a week. It's like, let's come up with a plan together. Does it work here? Does it work here? How much time? When can you do it? Can you change this? Can you modify this? Is this something you can bring into it? So it's finding the sustainable but realistic things.
Yeah.
And then once we know more of what's going on and how we are gonna approach fixing it.
And so when you're talking about physical therapy in general, like, you're at the forefront of something. What are you at the forefront of? Are you trying to make a change within the industry, or is there something that you want to, like, as a message for physical therapy that people might be a little, hesitant to get into because of their previous experiences? Is there anything that you want to put out there as a message that represents, like, Helix and what you're trying to do?
Yeah, I think it's just patient-centered and person-centered. I feel like oftentimes it can feel like churning out patients, like a factory at some places, and that's not the best care. It's not appropriate.
Do you have experience from a practitioner side? Do you have experience from a patient side of that?
I was so much younger, I probably wasn't paying as much attention to that. If I was or wasn't. And I think the practice was different back then, many moons ago. I think now, again, with it being an insurance-driven world, just when it comes to financial sustainability, there's some decisions that different practices need to make. And so that's what's nice about it at Helix. Like, we're one-on-one with the patient for an hour. And so we are able to take the time that is necessary to hear the patient and see the patient and come up with a plan and work together and take them through what needs to be dealt with every single session, and still have time to come up with a plan for them moving forward. And I think that's why most people get into physical therapy, and I think it has gotten lost at times. And I think that's what, if there was some sort of a message, it would be that, like, let's remember that we're doing this to help people. We're doing this to work together with people and to try to instill this lifestyle change and help people do what they love. I mean, that's what we're all here for. We want people to be able to do the things that they want to do, because that's more fun, right?
Yeah, exactly. And that's the problem, is that, like, a little behind the scenes look from what I've seen and dealt with as far as physical therapists, some very talented physical therapists that I've worked with in the past, that they got bogged down in this insurance component. It's not like insurance is a big bad wolf enemy. I'm not saying that. What I'm saying is that I think people don't understand that because they're adhering to that model, you have people who are not physical therapists that are telling the physical therapist what they can and cannot do.
Right.
And I'm not like spilling the tea or anything like that. This is just a well-known thing, and this is what you've had to deal with, I'm sure. Was there a point in your career where you're just like, oh, I can't be a part of this? Like,
yes.
Okay. What was that?
That was, like almost 7 years ago at this point. And that was when I went off and did my own thing.
Okay.
Because I felt that. I felt constrained. I was not able to help people the way that I wanted to, or that they needed, and that I felt was best. I was having a hard time living in certain constraints that were prescribed to me by somebody who has never met me, is not a physical therapist, and has never met the patient. And so I was like, well, I'm not gonna.
Yeah, they're just on the phone. You spent how long on hold for them for them to tell you what to do? And you're like, this is not how this works.
Right, exactly. Yeah. And so that makes it tricky, because then it's not patient-centered. It turns into the focus for a business to be sustainable is something different, and it's not the patient anymore. And that was why I was like, nope. So I started doing things on my own, so that I could help people the way that they deserve to be treated. And it has since, now I've joined forces with Helix, where we get to continue doing that.
Well, I think it's what people don't understand, is that everything that we've talked about this entire time is about a holistic approach, right? The body as a whole, the systems as a whole, your training, your physical therapist, coming to BFT as a whole. And then when someone goes into that model that you're talking about, it's isolated. It's like, okay, you have a knee problem, this is what you can do for your knee. And you're like, well, I don't think there's all life that happens outside of that one joint. And so when it does that disservice, then it gives a bad taste for anyone who's doing it. So then when they don't get better, it's like physical therapy, I tried that, it didn't work.
Right.
And I'm gonna write off a whole
the
industry.
global
Yeah,
physical therapy.
all of physical
Yes.
therapy, and you're just like, well, I don't know if that was a fair representation.
Yeah.
So I mean, has that experience made you, or it prompted you to maybe look at other industries a little differently? Like, like someone will write off surgeons, for example. And they'll be like, oh, they're just trying to make a quick buck. You're not like, but now it's like, well, because of that experience I've had, it's like, yeah, maybe there's more to it than that.
Yeah, and I think there's some of that probably in every profession, right? I think if somebody has a bad something or reads a bad review, then it's like, I'm never gonna try this, or I'm never gonna go that route, or so-and-so said this, so therefore it's not gonna happen. And it's tough because we as physical therapists want to give hope, to the people that like physical therapy is helpful and can be great, and you do have to pick the right one. Just like
you're literally trying to help. You're
we're
like Good Samaritan type of profession.
Like, we want to help, and it's tough when it gets tarnished because it does. It feels bad. Because like literally we just want to help make you feel better. And it's like, I could help you. I see how you're walking. I could help you. Let me help you, please,
So with your patients that are lifelong, you got like patients that are like sending you Christmas cards?
Kinda.
Yeah. Oh, okay. Yeah. That's amazing. Yeah. So that's things like we want to put forward and put front and center, not just people that are like, oh yeah, that's a great girl, that's a great guy, like, yeah, they're awesome, but like actually have that mindset you're looking for is actually patient client centered, and that's what we want. Is there anything else that you would want to tell the people about?
Helix Performance Physical Therapy in Danville. You can look on our website, helixpt.com, and there's a lot of information there. You can schedule there. You can send me an email, Meggie@helixpt.com.
Okay.
I live in San Leandro, so I'm getting to know more things about this area and this community, and I'm excited to be here and be a part of it. So, and thanks for having me.
Yeah, we're excited to have you. Yeah, so thank you for coming in. I know it's traditional handshake. I don't know, fist bump? Let's do it.
Sure.
Yeah,
Let's do it.
Let's get it. All right, thank you for coming in.
Yeah, of course.